Good morning, everybody, and welcome to Sovereign Health's webinar today on gut health, brain health, and behavior, presented by Cindy Dupuy. Everybody, please welcome Cindy Dupuy.
Thank you so much, Monica, and good morning, everyone. I am very excited to see that so many people have signed up for this and are interested in hearing the relationship between the gut and the brain. It is something that is becoming bigger, and I think people are beginning to realize the huge importance of it and how much power actually we have with that as far as treating many different diseases and disabilities, not only of the brain but other areas as well, which I hopefully will be able to show you the connection to other things as well as we go through. Hippocrates did say that all disease begins in the gut, and that was a long time ago. And he is very right, and we're seeing that more and more. Some of you who work with children and people which have ADHD and autism or on the ASD spectrum may already understand and have privy to observe the close relationship between the gut and food sensitivities and how it affects brain and behavior. Today I will be talking about the function of the digestive system specifically, signs of possible gut problems, and some of them actually may surprise you, how it relates to brain function, including mood disorders, how you can possibly identify when there are digestive issues, just in your own office, just simple ways, which can be very helpful in supporting your clients on a biochemical level as well as on the emotional and psychological level that you are already doing. So what does the gut have to do with the brain? They seem to be very far apart from each other, actually, and they actually both have a barrier. And the gut actually has its own nervous system, so in itself it's often coined or termed the second brain. The gut-brain axis is vital for maintaining homeostasis or balance throughout our body, and there's an increasing amount of literature connecting the bacteria in the gut or the digestive system with the health of our brains. There are actual doctors that study and treat their patients with what you guys would term as co-occurring, that's for your benefit, disorders of the brain and the gut. And those doctors and scientists are called neurogastroenterologists. So there's a whole other movement coming along. So signs of a compromised digestive tract, what's listed here are probably pretty obvious. We have heartburn, reflux. A lot of people think that's kind of normal. It just kind of goes along with things, especially as we get older, but it's not. Stomach distension after eating, upper abdominal pain, indigestion, belching, gastritis, which is actually a wastebasket diagnosis. We get that for if the doctors can't really determine and diagnose what's going on, it's either gastritis or IBS, and that's just goes everything in the trash because they really don't know what to do. Peptic ulcers, constipation, diarrhea, which I would say would be IBS, nausea, halitosis, undigested food and stools. These are all, fairly obviously connected with digestion. But this next slide here talks about some other signs of a compromised digestive system that I don't think many people make a connection to. So we can often have fatigue and unexplained fatigue, eczema, low levels of B12 and B6, which can be done through testing. A candida or yeast overgrowth, urinary tract infections are often associated with yeast infections. Depression and anxiety are often associated as well as missed. Elevated C-reactive protein, and this is a marker that that some doctors do test through blood, and it's elevated. It shows that there's extreme inflammation somewhere going on in the body. It doesn't necessarily have to mean it's digestive tract, but this is one of the indications. Hormonal imbalances can often be common, food sensitivities, migraines, and we'll see behavior disorders, and often in the ADD, ADHD, and autistic and OCD population. So you can see it's far-reaching, and again, it's not sometimes the most obvious. And there's a new hip word here, and it's called microbiome, and really what that means is it's just what's the bacteria that's occurring in our digestive system, which is good and bad bacteria. We want more good than bad. It plays a huge role in things like allergies and eczemas and autoimmune diseases. And autoimmune diseases are pretty widespread, and they would include things like Crohn's, colitis, rheumatoid arthritis, Hashimoto's, which is connected with hypothyroidism, lupus, MS, and it goes on. So before I go any further, I would like to tell you a little bit about me, how I got into what I'm doing. I don't know how interesting it is, but I like to tell it. I started off actually eating extremely well. My mom was a big fan of Adele Davis, and for those of you who do know Adele Davis, I just aged myself tremendously. She was probably one of the first pioneers that was talking about whole grains, whole foods, raw milk. So when other kids were eating that white, wonderful Wonder Bread, which we thought was just the cat's meow back in the 60s, I was being fed whole wheat bread, and I thought that was just really wrong in supplements. So I started off eating very, very well, and my life probably went along okay. Didn't have a horrible childhood. Parents get divorced, but things kind of went awry at about age 14, and it resulted probably because my mother was a very controlling mom, and I was just a little bit rebellious. And she put me in an all-girl Catholic school when I was 14 years old. And being the type of person I am, I guess I needed to control something, so I was controlling my body. And at the time, I don't even know if they had coined the eating disorder, anorexia, or not. But and I know my mom took me to a doctor and so on. I was very fortunate in that it did not get out of hand. It lasted for maybe 9 months, and that was it. But that was my first bout with that. Probably one of the things that always saved me throughout my whole life is the fact that I did eat fairly well. I was always able to sleep. I just didn't get too far off. I always suffered a little bit from chronic constipation, so there's obviously things going on in the digestive tract from early on. And I did suffer from chronic yeast infections probably from the time I was about 16. Again, an indication that things were probably a little off balance in the digestive system. But nothing was overt until in my early 40s when I went through a divorce. And that led me to, I did lose quite a bit of weight. Obviously, a divorce is very stressful. And even though my divorce was not an ugly one, there's still so much strain and so much unknown that it's just stressful. And that was my second go-around with the eating disorder, anorexia. And that lasted probably for about 2 years. And again, I didn't get to an extremely low weight. I was very lucky. I still ate well. It's just my weight was reduced. And I would say that did I really restrict? I'm not sure how much I did. But my weight was too low. It was. And then from there, I moved into chronic UTIs. I had extreme adrenal fatigue, severe reduction of stomach acid, parasites, bacterial overgrowth. I was a pretty big mess, and what happened is it was really difficult for me to digest my food, and I became a little bit restricted there because of that. So eventually what happened is my energy level was reduced to about a 3 or 4. It was really hard for me to put in a full day, and I wouldn't say I was depressed, but I would say I was a little more irritable and more anxious, or maybe a lot as I look back. But no panic attacks, and I always slept well, and I kept everything under control. Of course I did. I was anorexic. What happened, obviously I was in a state of affairs where it was beginning to interrupt my life. And so Western medicine was not helping me. I went to a naturopath, and that was a little bit helpful, but that still was not putting me back on track to where I needed to be. So I took things into my own hands, and my degree in dietetics from way back when, and my love and curiosity for the body, and my desperation to get better drove me back to the field of nutrition. And I really hadn't been there since I graduated from college. I'd gotten into other things. So it had been about 20 years, and I did have a lot of catching up to do. And during this catching up period, I stumbled upon functional medicine and knew that I had found my niche and took courses in functional medicine and was able to heal myself and then take what I learned and start to help others. So I got very, very lucky, and, you know, as anyone else who's gone through life, I guess, and anything that's been pretty huge as far as disrupting your life, you take what you learn and you're able to bring it to others. So I'm actually really glad I went through everything that I did. I do want to take a moment here to talk about functional medicine because I think it's extremely important, and I'd like to expose you to that. I do honestly believe that functional medicine is true healthcare reform, and I say that totally apolitical. And it's different. It's a different way of looking at disease and healing, and I think it's important again enough to take just a moment out here to tell you about it. Conventional medicine doctors are trained to treat with surgeries and medications, and there is absolutely a place for this when there is an acute infection, something like a heart attack or something that's life-threatening, and for diagnosis. It's definitely a place. I'm very grateful that we have that. But for chronic disease, which is what most people go to the doctor for, this conventional way does not work. Medications and surgeries do not cure things like diabetes and cancer and depression and heart disease and hypothyroidism and IBS and high blood pressure and rheumatoid arthritis, fibromyalgia. I mean, the list goes on as to why people go to their doctors. Medication does not cure these disorders. They just mask the symptoms, and you're often taking the medication for the rest of your life. So what functional medicine does, or how it is different, is that it heals from the root cause of the disorder or the disease. Functional medicine doctors or practitioners, I'm not a doctor obviously, I am a practitioner, we look at the underlying cause of why there's a dysfunction or dis-ease or an imbalance. So we do different types of testing, and we look at the biochemistry and physiology of what's going on in the body. And actually doctors have learned very, very well the biochemistry and the physiology of the body, but they seem to have forgotten somewhere along their journey and their training about how important it is and how it all works together. So functional medicine looks at this. We try to ferret out different types or use different types of testing to ferret out the reason for the imbalance. Many factors are taken into consideration when coming up with a plan to heal a person. So instead of dumping on supplements, and supplements can be used just in the same way as medications are for symptoms. We have to go underneath that. And we look at things like lifestyle, diet, stress, load of toxins, the health of the gut, which we're talking about here, hormone imbalances, and so on. So I think you get a pretty good idea what functional medicine is about. So I'm going to move on now to why you're here. Find out more about the digestive system and how this plays into the roles of helping your clients, helping you help your clients. So I'm going to take you on a journey first of the digestive tract so you understand what's going on in different areas and link that to some of the very important functions between that and what's happening in the brain. And this slide right here, I don't know how many of you are have ever come across the series of books that were produced for school-age, junior high-age children to explain fairly scientific things, but it was a whole series. I think it's still around, and Miss Griswold is the character here, and she's the one that's driving the bus. And they do a fantastic job, and if I can make this slide or the slide presentation As fun as she does in her books, it would be great, but I don't seem to have that talent. But I just wanted to show you this slide. You can see all the wonderful foods there that are on the bus, and she's diving into the digestive tract. But before we move any further, I do want to say, you hear this term all the time, that we are what we eat, and we are. It's very important. I use food as medicine all the time, but almost more importantly, it's what our bodies are able to do with the food. So the ability of our bodies to digest and then absorb the foods that we take in. Because if that's not working, we can eat a diet that's so clean, so good, and we're still at a deficit. So, digestion, or what's not really digestion, but the digestive tract. So digestion actually does start in our mouth. This slide here starts with the stomach. So what happens in our mouth, two things. One is we do start digesting through mastication, through chewing, and that is an important process. If we don't chew our food enough, then there's larger pieces going into our stomach, and it takes longer to break those pieces down, and our bodies have to work a bit harder. And I would say the majority of us, and I'm guilty of this as well, especially during the day, I eat pretty quickly and get it on down, so I'm not the best at this. Another way that we start to digest in the mouth is something that you're very familiar with, especially if you've ever had cotton candy. You put cotton candy in your mouth and it immediately dissolves, and that's with an enzyme that is in your saliva. So carbohydrate, especially simple sugar, digestion starts to happen on a chemical basis in your mouth. And then the bolus of the food is pushed down to your stomach. And I'm going to go through what the stomach acid does, which is produced by the lining in your stomach. It's extremely important. So the stomach acid is the HCl, hydrochloric acid. There are millions of people that are on antacids or proton inhibitors to reduce the amount of hydrochloric acid that our stomach produces, and this is causing a whole boatload of problems. And as I go through this, I think you will understand why. And a lot of people are taking antacids, obviously, because they are having acid reflux or GERD, where the acid is coming up through the esophageal sphincter into the esophagus, and that is irritating the lining in the esophagus. And this is a problem. I'm not saying it's not. But usually what the actual problem is not that too much acid is being produced, but it's that it's in the wrong place. For some reason, in other words, for some reason, the esophageal sphincter has been opened up and the acid leaks up, and there can be something pushing on the belly. It could be caused by being overweight, and it pushes the diaphragm up, pushes the stomach up a little bit, and it can push the bowels of the food up against the esophageal sphincter. Things like alcohol will also relax it, nicotine can relax it, the sphincter, as well as a meal that's high in fat. So different reasons. So reducing stomach acid is not really what we want to be doing, and we need to find out why there is a problem with the acid going into the esophagus. So the function of the hydrochloric acid, or the HCl, is extremely, extremely important. And I'm going to jump down to sterilizing food. Most people don't even think about the need to sterilize our food. So this is our first line of defense here, our stomach is. We take in pathogens all the time through our water, through our food, through our hands, all sorts of different ways they come into our mouth and go into our digestive system. And so it sterilizes it. So if we're reducing the amount of stomach acid that we need, we're going to be sitting ducks to pathogenic bacteria and parasites, and that's going to be a problem. The other mechanism of hydrochloric acid, and again this is extremely important, is it produces an enzyme that breaks down our B vitamins to make them available to us. So they can be vitamins from supplements, it can be B vitamins from our foods. Either way, we have to have this enzyme in order to break it down. And, you know, it's really important to have our folate available to us, which is a B vitamin. That has to do with neurotransmitter, making neurotransmitters, serotonin, as well as dopamine, as well as it's extremely important for the detoxification mechanism that's going on in our livers. So if we don't have enough folate or B12 available or B6, all of those processes are going to be compromised. And that affects the brain, affects obviously, the toxins affect the brain. Obviously, if we're compromised in being able to make a neurotransmitter, that's going to also affect the brains and moods and behaviors. The third factor, big factor for function that HCl has is breaking down our proteins. That's a lot of what goes on in the stomach. And breaking down proteins is very important for a number of reasons. One is to make our amino acids available. Again, this is extremely important as far as making neurotransmitters. And if we can't break our protein down very well in the stomach, that's going to slow down the digestion that happens in the small intestine. And that's going to allow for the food to stay there longer and possibly putrefy. And we've got all sorts of kind of what we call outgassing. Gases can be produced there. So our stomach is very important as the first line defense here and part of the ecosystem. And again, antacids really affect the ecosystem of our whole digestive tract and also depletes us of many, many different nutrients. And I'll go into that a little bit more down the road here. Okay. So we're going to go to the small and large intestine, and the small intestine is extremely important as far, again, as digestion and absorption. Sorry about that, guys. And okay. In the small intestine, actually, you don't want to have a whole lot of bacteria. It's actually kind of sterile. It should be. We have the most intestinal flora in our large intestine. And that's kind of where we want to keep it. Sometimes we can get different bacteria in the small intestine, and that can be a real big problem. The bacteria in our large intestine is extremely important. We have trillions of bacteria in our intestinal system, intestinal tract, and really we have more DNA in our gut bacteria than we do in our own DNA. And it's the health of the gut bacteria or microbiome that seems to affect very much the brain health. So bacteria obviously is important in the back to the small intestine. This is where enzymes come into play, and enzymes are produced in the pancreas. And actually, bacteria talks to pancreas to produce more enzymes. If we have things like leaky gut, which can be created by food allergies, also a dysbiosis or an imbalance of bacteria, all of these things can cause for an irritation and inflammation in the gut lining. And what happens is that there's actually little holes that can be created, very microscopic, that can allow for food particles to leak out, and it's not going to be in the right place. And so what's going to happen is our bodies are going to come marching out and treat this as an foreign invader and create antibodies. And that's when we start to see more and more food allergies. Celiac disease, which is an autoimmune disease, to wheat also can cause a leaky gut, and a lot of problems in the large intestines as well. The basic function of the large intestines is to eliminate waste and toxins, and that's extremely important. If we don't, we want to make sure we have at least one bowel movement a day. 2 and 3 is even better. If a client or a person is constipated, what's happening is that waste and those toxins actually, well, the water gets reabsorbed, and the toxins actually get reabsorbed as well, and that puts a load on the liver and the whole body and a lot of inflammation. We'll see parasites and yeast and bacterial infections also in the large intestine. So stool samples and stool testing, the right kind, the functional medicine kind, are extremely, I find, beneficial and important. It gives us a ton of information. So what causes the digestive system to get out of whack? Well, stress is huge. I think it's bigger than we realize in the effect that it has on the digestive system. What we eat and what we don't eat, so the foods that we do eat that can cause problems, and the foods that we don't eat that support the digestive system, so it goes both ways. Medications are huge as to what happens in the digestive system, and I'm going to talk about all of these a little bit in subsequent slides a little more in depth. Alcohol is a problem as well. Parasites and pathogens and food sensitivities also interrelated with the problem with the digestive system. And then again, stress. I cannot stress how important stress has an effect on the gut. And we all know that. We have that gut reaction. So what's happening in our brain, it goes right to our guts lots of time. All right. Also, I'm just going to mention, just throw this in, what we eat and don't eat. GMOs are a big part of what's happening with our guts. And I think we're seeing that more and more. So I'm going to touch a little bit on GMOs a little bit down the road. I think it's important and to know that some of the pesticides, especially the Roundup, is affecting and poking holes. Well, they've done some studies where it is affecting the digestive system of livestock and also in humans. There's an assumption, let's put it this way, it's happening in humans as well. And I believe it is, because we're just seeing way too many gut problems that we didn't see years back. So I'm going to concentrate on stress a little bit. And when I talk about stress, I can't help but go to the adrenal glands. Our adrenal glands are situated right, like little hats right on top of the kidneys. And they are important and influence many, many different functions in the body. And we can kind of get an idea just by looking at the things that they produce and are responsible for. So they produce cortisol in response to any type of change or inflammation in the body, extremely important. So even things like temperature change and blood sugar change, our bodies will produce cortisol in response to that. We cannot live without cortisol. Adrenaline, all of us know that adrenaline rush, it can be a cortisol rush too, but adrenaline's a little more fight or flight. It has to do with blood sugar regulation. That's important, and that can be very important for people who have an addiction, have addictions as well, especially alcohol. It produces something called Sig-A, which is an immunoglobulin, which is protective. Okay, so when you see the word immunoglobulin, just think of protection. And Sig-A will protect any mucosal lining, which includes your nose, which includes your lungs, your digestive tract. So if Sig-A is either too high or too low, that will affect the gut health. Okay, so in my experience, my own personal experience, as well as experience with dealing with many clients, is I can go ahead and work on the gut solely, but I only seem to be able to get about 75% healing unless I also address what's going on in the adrenal glands and the health of the adrenal glands. There are hormones produced in the adrenal glands, which aldosterone, which affects blood pressure. So if we have high amounts of stress and high amounts of cortisol being produced, that can increase blood pressure by increasing aldosterone. And then the opposite is true, is lots of people with adrenal fatigue will have very low blood pressure. And they'll get signs. You kind of can notice that if they go from a seated position up to a standing position, they get kind of lightheaded on a regular basis. That can be an indication. Adrenals also affect the thyroid hormone conversion of T4 to T3. T4 is the inactive form of hormone, and we can only use the T3, which is the active form. So if that's a problem, that conversion, that could be attributed to possible adrenal dysfunction. Adrenals are also part of neurotransmitters, too much or too little. And again, also part of stomach acid in the health of the mucosal lining in the stomach. And then they also produce sex hormones. So sex hormones are not solely produced in the testes for men and the ovaries for women. Adrenal glands also produce sex hormones, and that plays a role. Okay. So the second factor that I had listed on why we have a digestive system that gets out of balance, well, medication are what I call drug muggers, and you'd be surprised at how even over-the-counter pain meds like Tylenol and aspirin and things like that can affect our gut. So over-the-counter painkillers does rob us of our folate, and again, think of brain health. Think of as women who are pregnant, they had them increase the amount of folic acid that they're taking, and they've also added folic acid to our food. And I'm going to talk a little bit why that is actually a big problem, can be a big problem. But folate does have to do with brain health. It can also affect other B vitamins. Our intestinal flora can be affected by a couple different medications or drugs, and one, of course, and most obvious would be our antibiotics. And if you've been sick, you take a lot of antibiotics. You have a child that comes into you that has been exposed to a lot of antibiotics since they were young. Probably there's an overgrowth of bad bacteria. There's probably going to be a problem with digestion and absorption and inflammation and food allergies and sensitivities. We're going to see all of that. And surprisingly, those who are taking birth controls, so you have that age where they're taking birth control. Then you have the flip side. You have those women who are having hormone replacement therapy. So in postmenopausal years, often they're taking hormone replacement. And hormone replacement, unfortunately, and I don't know the mechanism, but it does seem to change the flora in the gut. So and also seems to deplete of B6 and zinc. And zinc is extremely important mineral. We have over 200 functions that we need zinc for. Stomach acid, again, if you're taking an antacid or proton inhibitor, we're depleting the body of so many different things. It is just one of the nastiest drugs, and there's so many thousands of people on it. It's really unfortunate. And we think about, I don't want to go into the B vitamins, I'm going to B12. We talk about B12, we talk about dementia, we talk about energy. B6, again, neurotransmitters, we also talk about energy as well, and detoxification. We have Prozac actually affects thyroid, and also can affect digestion. So that's why we sometimes see an increase in appetite, an increase in weight gain with Prozac. We can see that. It seems to interfere with the iodine. If a patient has high blood pressure, they're more than likely on a diuretic. So that's a flag right there, and that's abscess of vitamin C. Blood pressure medication can also zap us of zinc. Magnesium gets zapped here again, or not made available if our stomach acid is low. Let's see what else. I think that's it as far as medications, as far as what I want to go over here. But all of these right here, your vitamin B's, the zinc, magnesium, are all affected by medication. So that's a problem. So the foods that alter digestion and our digestive system and change our blood sugar and avoid valuable nutrients. Oops. A nice little breakfast like this. There's really nothing good in it. It might look good to you, but if your health is compromised, you start eating really well. And when I say eating really well, I don't want it to be boring. You can eat well and learn how to create foods and pick out foods that actually you can be very, very happy about. And that's one of the things that I like to teach my clients and teach people. I do have cooking classes because it can be a challenge for a lot of people to know what to change from. How do you change from this and make something good and appetizing and fun and satisfying? So foods like this, we've got high fructose corn syrup in here, which is going to change the flora of the bacteria. We've got caffeine in here. and the Mountain Dews especially, and the caffeine strips us of our B vitamins and changes blood sugar. We've got these wonderful fats here, not so much potatoes, just the fried foods, which is inflammatory. So we have foods that are just not giving us anything. And of course we have this nice white bread. And I'm going to include gluten in here, and there are so many people who are sensitive to gluten. And along with these processed foods, we have so many preservatives, artificial flavorings, and artificial sweeteners, sucralose, same thing as Splenda. And our bodies are not, we haven't evolved to know what to do with all of these chemicals. Our body just doesn't know. We have high fructose corn syrup in most ketchups and barbecue sauce. And by the way, fructose is a big culprit to a fatty liver, so non-alcoholic fatty liver. And the reason for that is fructose has to go to the liver to be metabolized. So we're seeing a lot of that. And then, of course, Velveeta, that wonderful chemical crap. It really is. There's nothing but chemicals in here. And I don't think they can even call it cheddar cheese. They can't, okay? They can't call it a cheese product. It's a prepared cheese product. I don't know if we can even say that anymore. So let's look at foods that do nurture and feed us. Greens are so good for us. And if you have a hard time getting greens in, then either do a blended drink in your blender or juice at least 2 to 3 times a week. And don't make it too sweet, all right? Maybe you have to ease into that, but maybe only 1 piece of fruit for 32 ounces, seriously. And we want to get as many greens as we can to get the folate, to get other different types of minerals. It's just a wonderful way. And juicing, our body is able to take all that nutrient in and doesn't have to break it down and is able to absorb it and benefit. So people that have a really hard time with digestion and absorption, I do prefer juicing over a blended drink. It's easier on the digestive system. If you don't have a problem with that, then I like blended drinks because you get more of the fiber in it as well. This is another wonderful kale. There's some wonderful kale salads out there with wonderful dressing and some nuts to put on it, nice avocados to put on it. You can have organic corn. This is just a nice little wonderful array, and it makes my mouth water because when you saute red peppers, they get sweet in the taste. You've got sauteing, and hopefully it's either in coconut oil. I'm okay with butter. We've got zucchini in here. Looks like maybe even some green beans and onions. And maybe a little yogurt and sour cream and top of avocado. It doesn't get better than that, really, if it's done correctly. And you add herbs and seasonings to it. I love fruit and I love figs. And unfortunately this year our fig season, probably because of our drought, the figs were not that great and the season was not that long. Very disappointed. Herbs and seasonings are extremely important, so we probably are seeing turmeric here and a little bit of garlic, possibly curry. Pepper also helps our body absorb different types of herbs and spices. Herbs would be your basil. That's also very protective and antibiotic. Has antibiotic properties in it. And then we've got cilantro, which is great for detoxing. So trying to season our foods with herbs and spices, which makes our mouth happy and makes our bodies happy, instead of relying on salt and sugar and on vinegar, which is what we find in artificial flavorings, which you find in so many of the packaged foods. Excuse me. However, beans give us a big source of magnesium. We are very magnesium deficient society, very, very magnesium deficient, and that has to do with anxiety, has to do with relaxing your brain, heart health, constipation. There's so many different mechanisms and functions of magnesium. Depending on who you're talking to, we're talking 300 to 500 functions. I know it's a big range here, but I'm putting it out there. Eggs. Eggs are wonderful for us. The whole egg is wonderful for us. Most nutrition is in the yolk. So please don't just go with your egg whites. And egg yolks do not increase cholesterol. The cholesterol is made in our bodies. There's something else going on. And of course, the best would be to get pastured eggs. So we have all the wonderful feed and omegas and all of that in there. If the eggs are not pastured and organic, I might want to stick with the egg whites only for that reason. All right. So moving on to maybe giving you some solid ways of you to screen your patients for possible nutrient deficiencies and digestive issues. So as you're talking to them, of course, on all the psychological issues and helping them learning how to cope with life and their behaviors and emotional things that are going on, which is so important for everything I've been talking about. Everything from adrenal health to gut health. If our minds are not working properly, that's going to affect the rest of our body, and then it's a full circle. Anything that's going on in our guts or adrenal glands are going to affect our brain. So it's definitely a full circle, and it is that brain gut axis, AXIS. So on your intake form, if you're not already, well, I know you are already, you're asking them what type of medications, if any, they're taking. So these are really nice clues for you to kind of go, maybe there's something going on here where they could benefit from some other type of help on a biochemical level. So if they're taking antacids or Prilosec, Zantac, Nexium, that, as I said before, is going to deplete their body of a lot of essential nutrients, which is going to make a difference on anxiety, sleep, stress, and their gut, okay? Prozac possibly going to affect thyroid. Thyroid is so important that we have a receptor site for T3, or for the active thyroid hormone, on every single cell in our body. That's how important thyroid is. If they're on birth control, or if they're in menopause and on HRT, hormone replacement therapy, if they're on thyroid medication, if they've recently been sick, antibiotics, or if they've been sick a lot in the past, if they're taking over-the-counter pain meds. These are all things that are going to affect their body and possibly their behavior. If they are depressed and anxious, they could very well be having a problem with the gut. If there's an eating disorder going on, especially anorexia, there is a gut issue going on. I guarantee it. And remember that serotonin is basically made in the gut. That's where we get it. So if the gut bacteria is off, often we're going to see a problem with serotonin. It's not the only source of a problem of making serotonin, but that's definitely one of the first line of defense I would look at. If you have a client on the ASD autistic spectrum or with ADHD, there's most likely a gut issue going on and food sensitivities for all these people in the population. And there's often, especially with ADHD, low amounts of omegas. If you have a client that's a vegan, a vegetarian, I'm not against that, but the problem is with that, especially if they're raw, is they're not getting enough protein, the blood sugar is often out of balance, and there can be a lot of problems with that, especially with autoimmune disease. I'm seeing that. A lot of them don't get enough protein. A lot of them do not get enough zinc, because we get a lot of our zinc from protein, omegas, iron, and then B12 as well. So they're at risk, and so this is another way of screening. Obviously, your client coming in with PTSD, loss, change, trauma, especially childhood trauma. You can imagine if a child is traumatized year after year after year, there's that PTSD, the adrenals are going to be hit again and again and again. They're going to react to things differently and more often than other people. And I'm not telling you anything new, but what I want to do is connect the dots between that and what's happening with your adrenals and usually what's happening with your gut. So there's definitely a connect between all of that. If you have a client that's gone through or going through chemo or radiation, this is also another area of changing and affecting the gut. And if you have anyone that's ever had bariatric surgery, that's also, they're often compromised. So pretty much anyone who's coming in to see you is going to probably benefit from being supported on a biochemical level. So what are some supplements that you can, I hope, very comfortably suggest to your clients that they are often most deficient in and would be innocuous and probably give them a lot of benefit? The first and foremost thing, well, I'm not going to say it's first and foremost, but these 5 things that I've listed here, these supplements that I'm listed here, I would say people would benefit greatly from, and that would be magnesium in the form of magnesium glycinate or citrate. A really good mineral support. Most of us are deficient in minerals. Our soil has been depleted, and I see a lot of benefit from people taking additional mineral supplements, especially those with bipolar, who are bipolar. Really seem to benefit from that and notice a difference. And actually, lithium, lithium orotate, which is a salt, is part of our minerals, and the mineral that I carry does have lithium orotate in it, and I think that is part of why they feel a difference. A B complex is extremely important to make sure that they're getting the B6, the folate, B12, all of that. And in the next slide I'll be talking more about the absorbable forms of B, the B vitamins. If we're taking the B vitamin, might as well make it absorbable or don't even bother. Omega-3s, again, are extremely important. And then a probiotic for a lot of your patients is also going to be very, very beneficial. All right, forms of B vitamins. You want these specific B vitamins to be in a methylated or available form. And when you think of B vitamins again, it's not only part of neurotransmitters and brain health directly, but indirectly to brain health, it's part of your detoxification system. If the liver cannot handle toxins, those toxins are going to go to the brain. So when we think of B vitamins and methylation, just think about cleaning out and dumping out the sewer system in our bodies, okay? Really important. So I'm going to move to folate, which is different from folic acid, and I want to make that distinction. Folic acid is a synthetic man-made form of folate. The best way to get our folate is through leafy greens. So if you're juicing a lot, eating a lot of greens, there's a good chance you might be getting enough. There are a portion of the population that actually have a gene that prevents them from utilizing folate. So they have to take the folate in a methylated form. So you want to find a form of folate, which can be in a B complex. And if you look at the back of a supplement, it'll tell you the form that it's in. And you want it in a form like tetramethylhydrofolic, and I know it says folic acid here, but when it's tetramethylated, it's okay. No worries. Okay, it's taken the folic acid and it's methylated it, so it's available to the body. And even if a person has a gene that prevents them from making it into the active form, the body will be able to utilize it. And that is why some clients that are maybe not real responsive to an SSRI, when we throw in Deflin or something like that, it can be a lifesaver for them. And Deflin is available in prescription form, but there are also over-the-counter forms of folate that are available that can be very helpful. Okay, B12, methylcobalamin, pyridoxal 5-phosphate. These are all forms. Over-the-counter brands would be Jaro, New Chapter, and then Twin Labs. Those would be ones that you might find very helpful. So that pretty much wraps it up here. Here's some information, my information, if anyone would like to get a hold of me and discuss anything further. If I can be of help, please let me know. I know Monica said, I think there are some questions, so I'm going to turn it over to her at this point in time and see if there's any questions that I can answer, and if she's got more to talk about CE units. Okay?
Yes, thank you, Cindy. We do have a couple questions, but before I get to that, I just kind of want to explain to everybody how to get your continuing education units. You'll need to go to our website, which is www.sovinstitute.com. If you don't already have a login, you'll need to create one. You'll be receiving an email within the next 72 hours, with the link that pertains to this presentation. We're getting a lot of questions about, can I download the presentation? Can I get a recording of the presentation? We are recording it, and it will be available for you to view and access and watch as often as you need to reference to it in about 72 hours. So we'll have that link provided to you very shortly in the next couple days. We do have some questions from the audience. Let me go ahead and go to the first one. Okay, you mentioned, this is from Jason, you mentioned that acid blockers or antacids can be a problem. I have never been a drinker or overweight, but I do have a hiatus hernia. Should I not be on the acid blocker prescribed for that? Is there any way around this?
Okay, that's a tricky one. I don't know what kind of acid blocker you're on. If you're on a proton inhibitor, what happens is it really does block the production of acid, and so what happens is when you try to come off of something like that, the body's trying so hard to counteract the blockage of acid that it will overproduce acid, and sometimes you get stuck. So you have to come back from it in a very slow way. There's something called zinc carnosine, C-A-R-N-O-S-I-N-E. And zinc carnosine works extremely well in healing the gut lining. I know hiatal hernia is more of a physical thing that's going on, but if you're reducing your stomach acid, you might try slowly putting in the zinc carnosine and slowly coming back on the acid blocker, and just see if that's helpful to you. It's a little bit different here, okay?
Okay, we have another question pertaining to acid blockers as well. This one is from Debbie. What do I do if somebody is on an acid blocker, having pain, but the doctor is increasing the meds instead of reducing?
Yeah. Debbie, I would say the same thing. Well, one is to start with the zinc carnosine, but the other thing is to make sure that the doctor has screened for H. pylori. H. pylori, a lot of people do have it. A lot of people don't have any symptoms, but that can reduce actually the acid, and we can have more problems. So when you start getting an acid blocker and there's irritation in the stomach lining, a whole boatload of problems can happen, and it can be a snowball effect. So we have to find out why there is excess acid or problems going on. We need to repair the stomach lining, we need to remove whatever is causing inflammation, and then repair it with that zinc carnosine. I'm telling you, really helps on so many different levels. So that would be helpful for your client as well.
Perfect, thank you. Suzanne has a question. Does it matter what time of the day one takes supplements, and can they be taken all at once? Should we take them with or without food?
Good question. It depends. If it's a probiotic, I like it on an empty stomach. It's best absorbed that way. Our B vitamins, I think, are best absorbed, and maybe not so much fat soluble, but even the fat soluble vitamins, probably best with a meal. A lot of people, especially if they have a problem with stomach acid, will feel nauseous if they take their B vitamins without a meal. So can you take them all at once? Yeah, you can. Like you can take your Bs and your omegas and even your minerals all at once with a meal if you like, or break them out over the day. So the probiotic is probably the one thing and maybe minerals, one thing I'm more particular about. Magnesium I like at night. You can take it both morning and night because magnesium does have a calming effect and can help with sleep.
Perfect. Okay. We have time for one more question. I'm not sure I'm going to try to say what I think he's trying to say.
Okay.
Can you say more about SSRI effects on the thyroid and or other systems?
The only effect that I'm aware of is that apparently it can interfere with the availability of iodine. And iodine is essential for making thyroid hormones. So there is a possibility that your patient on the SSRI might be deficient in iodine, and that's interfering with thyroid production or hormone production, and they can be tested for that. They just might need a little more help, and that's just a nice awareness to have. I hope that answers the question.
Sure. Debbie asked if you can repeat the last, the supplement that you were talking about, the zinc. I think
Carnosine, it's zinc and then carnosine, C-A-R-N-O-S-I-N-E. And it's a chelated, so the zinc is actually chelated or bound with the amino acid carnosine. And it works differently than just regular straight up zinc that you would find, in a mineral supplement. So it's the two, and that combination adheres to the lining of whatever it touches. And so even if the form that I carry is in a chewable form, so if someone's having mouth sores, that actually if they chew it in their mouth, that's actually going to help even there. So mouth, your stomach, it's a wonderful little, supplement that it works really well.
Okay. We're going to do just one more.
Okay.
I think this is a pretty good question that might pertain to some different people. Did I just lose it? Okay. What would you suggest for somebody with severe migraines or pain that sometimes has to treat them with opiate medications? They're already taking the magnesium, B vitamins, multi, and probiotics. So what would you suggest for people that have to take opiates?
Oh, boy. The opiate's going to wipe the magnesium out. It is. I would like to almost address that a little bit differently if I'd like to get that license. I would definitely, and maybe they've already done this, maybe they've already looked into food sensitivities. Maybe they've already looked into thyroid. Thyroid is often an issue with migraines. Food sensitivities, especially gluten, is often an issue with migraines. And some people, even though maybe the person's taking magnesium, some people can even take up as much as 2,000 milligrams, which is a lot. Most people take around 400 milligrams, up to 2,000 milligrams if they really have a difficult time absorbing magnesium. And there is a small population that has that problem. So I would up the magnesium and make sure minerals, look at food sensitivity, especially gluten and dairy, and then look at thyroid production too. And by the way, a lot of doctors, that range you see on the blood test, you want to be closer to the higher range. The lower range, it's too low. It's just too low.
Okay. All right, that is all the time we have for questions today. Thank you, everybody, for participating. Thank you again to Cindy for your presentation and for collaborating with us today.